All right. So, good morning, everyone. My name is Tiffani Hart, Director of Professional Development, and welcome to the Florida Assisted Living Association's webinar entitled Vaccination Rollout: What Your Community Needs to Know. Unlike our typical webinars, CEUs will not be provided with attendance in this webinar. Our goal was to gather our state leaders together, as well as our pharmacy industry professionals, to providing comprehensive overview, guidance, and clarification on the distribution of the coronavirus vaccination into the long-term care facilities. This webinar is being recorded and will post to our website once it's rendered. As a quick introduction, we are honored to have State Surgeon General Dr. Scott Rivkee. He is focused on protecting, promoting, and improving the health of everyone who calls Florida home. Dr. Rivkee has had more than 30 years of continuous research funding from the National Institutes of Health. He has more than 250 publications. Before moving to Florida, Dr. Rivkee served as professor of pediatrics with tenure at Yale University. As associate chair for research, he started and directed the Yale Pediatric Thyroid Center, one of the first of its kind in the United States. Dr. Rivkee has committed his career to building the culture of health that can help each adult and child in Florida live a long and healthy life. We also have the Agency for Healthcare Administration, Kim Smoak, Chief of Bureau of Field Operations, serves as the Agency for Healthcare Administration Chief of Bureau of Field Operations with more than 2 decades with the agency. Under Kim's leadership, the field operation directs facility inspections, which evaluates management and administration, dietary, social, and nursing services, as well as compliance with state and federal fire safety codes. The Bureau of Field Operations also maintains records of survey deficiencies and completes survey reports when necessary. The field office recommends sanctions, fines, and decertifications, as we all know. Brooke F. is CVS's senior director. She's an attorney with over 20 years with the company, first as Aetna and then with CVS Health as part of as Aetna's acquisition. Turner currently covers 3 states in the Southeast regions as part of her responsibility. Prior to that, she worked as an administrative law judge with the Georgia Insurance Department. Turner has a bachelor's in political science from Boston's University and a Juris Doctorate from Suffolk University Law School. And lastly, but certainly not least, we have Sally West, Walgreens Regional Director. Sally West joined the Walgreens Government Relations team in November of 2012 after serving for nearly 10 years as the Director of Government Relations for the Florida Retail Federation. West led the FRS Chain Pharmacy Council and successfully championed the passage of major healthcare price transparency legislation, as well as legislation expanding the authority of pharmacists to administer immunizations. At Walgreens, West manages the government relations activities for 6 states and has overseen healthcare related projects throughout her region, including the expansion of pharmacist scope of practice, increasing awareness of vaccine preventable disease, and promoting the use of medication therapy management. So without further ado, thank you so much, Dr. Rivkee, again for joining us, and you may take it away with your presentation.
Yeah, thanks so much. It's a real honor to speak before you again. And you guys are doing a terrific job, and really want to thank you for your leadership there. Also, the response that we've had to the state to this pandemic has really just been absolutely incredible. It's involved so many different agencies. Really want to also express my appreciation to AHCA. I know we have Kim Smoak on the fall, and then also really excited to working with CVS and Walgreens as we prepare to vaccinate the most vulnerable in our state, people in nursing homes and assisted living facilities. So, first, in terms of where are we today in terms of COVID in the state? We do have a lot of COVID in the state of Florida, and some of the indices that we look at in terms of whether we have an increasing spread We are seeing increasing spread in the state. And so what this means is that we really need to continue to focus on our mitigation measures. It's terrific that we now have a vaccine on the horizon. This really gives us an incredible path forward out of this pandemic, and really an incredibly important tool to help the most vulnerable in our state. But I can't emphasize enough the importance that we continue our mitigation measures. Again, we know this is a respiratory transmitted virus spread by the spoken word, by the breath, by the cough. And for individuals who have COVID, particularly individuals who are younger, up to half of individuals who have COVID may not know they have it, and they're asymptomatic, but they can spread the virus. For individuals who are symptomatic, over the 2 to 3 days beforehand, they can also spread the virus. So this is why it is so incredibly important that mask wearing in the proper way absolutely continue as we're continuing to battle COVID. We need to keep COVID out of our facilities. This is why it remains very important to be able to screen workers, visitors to facilities for the signs of COVID-19, fever, cough, shortness of breath, sometimes just feeling tired, gastrointestinal symptoms, and recent contact with individuals who have had COVID-19. We are seeing some increased spread in terms of number of cases of COVID in our nursing homes and assisted living facilities in our state. So this is why can't emphasize enough the importance of the mitigation measures, which really need to be relentless. Since over the past couple of weeks, CDC has also issued some additional guidance related to quarantine and exposure, which is important to go over. So an exposure to somebody with COVID-19 that increases one's risk for getting COVID is if somebody's exposed to somebody within 6 feet for 15 minutes. This could be the same person, one 15-minute exposure, several over the course of the day, or different individuals. And in this situation, the gold standard remains individuals who have had this type of exposure, isolate for 14 days, and then can return afterwards if they aren't ill. Why this 14-day period? Because first, half of the patients who develop COVID after an exposure will get it by about 5 days, but in up to 10 days, 90 to 95% of individuals will, but by 14 days, more than 98, 99% of individuals will. So this way, if you're working with a high-risk population, it minimizes this risk. CDC, though, came out with some revised guidelines a couple weeks ago, and they said that in certain settings that following exposure, you can shorten the isolation period to 10 days without testing, or 7 days with testing at day 5 and 6, assuming that they're normal. However, this does not apply in situations where you're working with medically vulnerable individuals, such as nursing homes and assisted living facilities. So even though you've read about shortening the quarantine period from 14 days, it is still recommended that if you have employees, staff, visitors who've been exposed to people with COVID, that the isolation period of 14 days stand. Another important thing that has come on the horizon is a medication that for individuals who have early COVID and are in a medically vulnerable group, that can decrease the risk of being hospitalized and having to go to the emergency room. And these are monoclonal antibodies from Lilly and Regeneron. And what these are synthetic peptides that will actually attack the virus and stop it from attaching to cells. So if an individual is symptomatic and they're treated with this within the first 72 hours, this will decrease their chance of being hospitalized dramatically. And in this indication, this is per the Food and Drug Administration emergency use authorization. Individuals older than 65 years of age, or have diabetes or have obesity, and they have a number of other conditions as well. So if you have, and this has to be given by an intravenous infusion followed by 60 minutes of observation afterwards. So hospitals all across the state have this medication. So if you have individuals in your facilities who become positive for COVID and they become symptomatic, reach out to your local hospital because they may be excellent candidates for this very important preventative medication. And we're also really excited that this week we started vaccination against COVID-19 in many parts of our state. So the vaccines that we've had in our state this week, this is the Pfizer vaccine. Yesterday, there was a hearing before the Food and Drug Administration for a vaccine from the company Moderna. And both of these vaccines have similar technology. What it involves is generating a piece of genetic material called messenger RNA, which is injected into a muscle. And then the muscle cells will take up the messenger RNA and will actually produce part of the virus, something called the spike protein. And this would trigger an immune response against the spike protein. And the spike protein plays a very important role in terms of attacking cells, which allows virus entry. So that's the mechanism behind this. And this is really exciting new cutting edge technology for this. In terms of the difference in the Pfizer and Moderna vaccine, absolutely the same technology, going to have the same safety profile, and preliminary data suggests they have similar degrees in terms of protecting individuals, where more than 90% protection, which really is absolutely phenomenal. A few differences. Both of these are a 2-shot regimen. With Pfizer, the second dose is given typically 21 days after the initial dose. And with Moderna, the second one is 28 days later. The Pfizer vaccine has to be stored in ultra cold storage, freezers that are minus 80 degrees centigrade, whereas the Moderna, it's a standard freezer which can be used. But again, similar technology, similar side effects, similar efficacy. And each state has been asked to identify which of these products will be used for individuals in nursing homes and assisted living facilities. And we are using Pfizer for this because this was the first one which became available. And we're extremely important and extremely interested in having those individuals in our state who are most vulnerable be vaccinated as soon as possible. As many of you heard on the news, vaccination took place in a few counties in the state at nursing homes by state teams, and then also, I believe, later on this week by CVS and Walgreens, and certainly more and more next week. So this is a tremendous partnership with CVS and Walgreens. I'm really glad that you're on the phone today. As far as nuts and bolts questions that people may ask, if you have a vaccine from one manufacturer, does the second dose have to come from the same? And the answer to that is yes. So if you had Pfizer initially, you have to have Pfizer for your second dose. Can this be given to individuals who are immunocompromised, have been treated with cancer in the past, things like that? And the answer to that question is, first, we recommend that everybody have a conversation with their healthcare provider about that. But according to the CDC, these individuals can be vaccinated. We know that a good part of our workforce involves women of childbearing age. And the question comes up, what about women who are either pregnant, thinking about getting pregnant, or are nursing? And again, we always recommend that the individual have a conversation with their healthcare provider. But the American College of Obstetrics and Gynecology has issued guidance on this. and they say that for women who are pregnant, that they should not be denied the vaccine if they're in the prioritized group, and that women who are lactating can receive the vaccine. But again, it's recommended that they have a conversation with their healthcare provider. Questions have also come up about allergic reactions. And in the initial 15,000 individuals who were vaccinated in the United Kingdom, about 3 individuals had allergic reactions. And so what is recommended, and this comes from the CDC and FDA, is that if an individual has had an allergic reaction to a vaccine before, or they've had an allergic reaction to an injected therapeutic, a drug, other types of medications, that those individuals not be vaccinated. If people have had food allergies, environmental allergies, pet allergies, they can be vaccinated. It's recommended that individuals be observed for 15 minutes after the vaccine in case they develop it. And it is also recommended that when vaccines are provided, that the individuals or groups giving the vaccine have an anaphylactic kit right there. This consists of epinephrine and Benadryl, which is a treatment for an acute allergic reaction. One of the other questions that comes up has to do with side effects. So, with the Pfizer vaccine, where the data are published about this, we'll get more information about the Moderna. Again, 2 doses. After the first dose, about 3% of people had side effects, and I'll talk about what those are in a little bit. And after the second dose, about 15% of people will have side effects. So in terms of the most common side effects, these are tenderness over injection sites. Some people may feel tired. Some people may have muscle pains. Some people may have headaches. And a small minority of individuals may run a fever as well. And so, and again, this appears to be more after the second dose than with the first dose. So these are flu-like symptoms, and also could be COVID-like symptoms. So the question is, after people are vaccinated and they get side effects, what do they do? And so we know that there's COVID in the community, and these symptoms can overlap. So what's recommended is that individuals with symptoms that could be after the vaccine, that these individuals continue to monitor themselves. If people do feel ill after the vaccine, it's recommended that they not work, treat themselves with Tylenol, and if they have been in a situation where they think they have been exposed to COVID, again, because the symptoms overlap, it's recommended that they get tested. However, if the symptoms go away within a day or so, testing is not needed. However, if the symptoms worsen or persist for more than 2 days, these individuals should continue to stay home and get testing for COVID. Also, wish to mention that when individuals are vaccinated, that these individuals, that the shots need to be entered into the system called Florida Shots within 24 hours. We also prefer that things be entered lifetime or before 9 o'clock the evening before, just so we can track things, but certainly within 24 hours. And in terms of vaccination, in terms of the initial prioritization groups, and this comes from again, FDA Advisory Committee, immunization practices, healthcare workers, particularly those with who are high risk of exposure, and then nursing homes and assisted living facilities, both residents and staff. So, it's amazing that we're in this situation. We had our first 2 cases of COVID on March 1st in Florida, and here we are about 9 months later, having a vaccine, which is really going to give us a path forward out of this pandemic and certainly protect those in our community who are most vulnerable, which are the residents in our nursing homes and assisted living facilities. So again, I wish to thank all of you on this call. You've been doing a terrific job in terms of keeping COVID out of your facilities, and my admiration goes to all of you. And also, it's hard to believe that we're in holiday season, and really, my thoughts are with all of you and your families as well over these special holidays. Thank you.
Thank you so much, Dr. Rivkee. I forgot to mention, if you all have any questions during this presentation, please be sure to use the chat panel to address them there, and we'll try to address those questions as time permits before the end of this webinar. And next we have Kim Smoak.
Hey, thank you. And thank you, Dr. Rivkee, and thank you and your team, Dr. Rivkee, at Department of Health. We work very closely with Dr. Rivkee and his team, whether it's at our state EOC or out in the field. So thank you for everything that you're doing in your leadership during this time, Dr. Rivkee. So I just want to say a couple of things. One, the ESS Emergency Status System daily reporting. As you know, on Monday, the 14th, we sent out an alert and added some additional questions in the additional info tab. These questions are related to the administration of those first doses of COVID-19 vaccination to your staff and your residents. And it's very important that you update this. As you know, we've made it very clear. And also, as you know, my staff are looking at this on surveys as that you are updating ESS every day, and you're doing it at least by 10 a.m. until further notice is sent out to you. So it's very important that you provide to us the number of staff who received the first dose of COVID-19 vaccination as of yesterday. So for the previous day, that's 12 a.m. to 11:59 p.m., the total number of staff, in addition to there's another field for the total number of residents who received that first dose of COVID-19 vaccination. In addition, we also have another field for the cumulative number of staff who received the first dose and the total cumulative number of residents who received the first dose. So please make sure that you are updating this for us every day by 10 a.m. We really do appreciate that as well. So thank you for that. And I know Dr. Rivkee's made a point of reminding everybody that, we are continuing to see cases increase in Florida. As you know, my staff in the various field offices in the states, in addition to the county health department staff, as well as the AHCA, the Healthcare Associated Infectious Disease staff, under the direction of Dr. Nikki Dotson, we are doing joint visits with various staff at Department of Health in the field. And we're going in, as you know, doing infection prevention and control investigations. It's very important that we continue to stay strong and focus on our infection prevention and control measures out there to mitigate the spread of COVID-19, again, as we are seeing cases increase throughout our healthcare facilities. So it's very important that we continue to stay strong and do what we need to do to keep COVID out of our buildings. So that's it for the vaccination and just other COVID information I wanted to share. One other thing I also wanted to bring to everybody's attention, and CMS provided us state agencies this direction on Friday, and I think that this will help with continuing with your point of care testing for your SARS-CoV-2 testing that you're able to do with your point of care devices. So one of the things that CMS has done is to temporarily exercise its enforcement discretion under the CLIA program for the SARS-CoV-2 point of care testing. So what this means for you and for us as well, when a facility such as an assisted living facility submits a CMS 116 application for a CLIA certificate of waiver, and that's what you've been doing, and we appreciate you guys getting those applications into us. So once you send us the application, we know it does take time for us to process this application, and unfortunately, sometimes things don't come to us 100% accurate. We understand that. and we continue to work with you, that even facilities that have applied for a CLIA certificate of waiver to perform SARS-CoV-2 point of care testing, once you've submitted that application to us, you can begin your testing with your point of care device and reporting patient-specific results, as soon as you've submitted your application to the state agency, which is us here, the Agency for Healthcare Administration. So CMS, this is something new, hot off the presses as of actually a week ago. CMS sent this information to us, so I wanted to share that with you. I know periodically I get emails or calls from assisted living facilities about the status of your application, and that's one reason why CMS proceeded with allowing these flexibilities. So this is really, really important for our non-certified facilities. Will be treated as operated under that certificate of waiver while your application is being processed. So you got to submit the application. Once you do, you have your point of care device, you can start testing. And again, it's important that you remember to report those results within 24 hours to the health department. So just wanted to share that as a bit of good news for you as well. So again, thank you to Follow's leadership for providing me this opportunity to be with you guys today. And thank you for all that you're doing day in and day out to protect our residents and our assisted living facility communities. So thank you, Veronica and Tiffany. I'll turn it back over to you guys.
Thank you, Kim. So next we have Brooke Tenner.
Hi, yeah, thanks for including me, and thanks for giving me the opportunity to be here. I did share, I believe, and if I haven't, I will, with Tiffany, the landing page that we created for the facilities and for information that's sort of consistently updated for the facilities to access, includes our consent form and other information that will be helpful. The clinic vaccine clinic guide, other information that will be helpful, ways to update contact information for the facilities once they are scheduled. So hopefully that will be helpful for folks to answer some questions that have come up. We, as Dr. Rivkee's mentioned, and thank you to Dr. Rivkee's and thank you to Kim and AHCA, we are beginning our vaccination clinics on Monday, and we have started that process. We will start that process. We are going to be vaccinating and holding our clinics all next week, with the exception of Christmas Day, and we will be doing clinics on Saturday to make up for Christmas Day. And if there are, issues or concerns about those scheduling, I know I saw a question in the chat, and I think Sally, my Walgreens counterpart, had responded to it. We're happy to try and triage those. There is an email for questions for the facilities to ask questions as well that went out to all of those facilities that have been scheduled. But we're happy to try and triage those as best we can. We're excited to start the process on Monday and start the vaccinations on Monday, and continue to work with the state as we roll out to the other facilities. I think, as everybody knows, and I believe Dr. Rivkee's mentioned this, that the skilled nursing facilities were put in the first category. My understanding is the state is working on rolling out the additional facilities with the CDC, which we will then be starting to schedule once that rollout has happened, as we did with the SNFs these last couple of weeks as we got the scheduling going. So hopefully that helps, at least with initial information, and we can work on answering questions, I guess, Tiffany, at the end, unless there's something that I haven't covered.
Yes, we'll get those questions answered towards the end of this presentation. Thank you so much, Brooke. Sally, you are up next.
Hi, everyone. Sally West, Director of Government Relations for Walgreens. I'm excited to be here today with you all and to work with you on getting all of your staff and patients vaccinated with the COVID-19 vaccine. We have started scheduling as CVS has as well. I do want to let you know that we, Walgreens, just got about 200 skilled nursing facilities sent down into our system on Wednesday. So if you registered with Walgreens but have not received a call from us yet, you are likely one of those 200 facilities that were just pushed into our system from the CDC. So having said that, I am more than happy to look up your facility. And if you registered with Walgreens, I'm happy to look up your facility and see if you are in there. What I'll do is I'll send my email to Tiffani, and you can ask her, and I will certainly look you up. I'm happy to do that for you. And with that, just make sure that you provide your specific contact information so that I can ensure that we have the correct information for our staff to call you and schedule you. So I think that's all I have. Our information is pretty much the same as CVS as far as rollout goes. We did roll out a few facilities in Jacksonville today because we were able to get some of our inventory ahead of schedule. However, we are not anticipating that for the rest of the state to get that inventory in advance. And so we will be rolling out with our regular schedule on the 21st, Monday. And one thing I do want to mention is right now, the state has not turned on assisted living facilities. They have only turned on skilled nursing facilities. So if you are an assisted living facility, you will not be scheduled yet. And we need to wait for the state to turn on that portion before we can contact you and begin scheduling you. So right now, we're only scheduling skilled nursing facilities. I think that's it for my part. Tiffani, if you want to maybe kick it off for question and answer, or I don't know, however you want to run this.
Sure, yes. Thank you all so much again for taking the time out of your day to provide this webinar to our members. So as far as questions go, we do have a question, I believe it may be for Dr. Rivkee. If you have a head cold, should you wait on getting vaccinated?
Thanks for your question. It's similar for all vaccines. If an individual is ill, you should not get vaccinated while you are ill.
Perfect, thank you.
Tiffani, I'll jump in with one.
Okay.
If a person has had a TB test recently, will there be an issue with receiving a vaccine?
No, if somebody is thought to have active tuberculosis and they're infectious, that's a different situation, in which case refer to the provider. But if somebody has a tuberculosis test, that should not make them in a special circumstance, so they could get vaccinated.
All right. One person asked, when can we expect the ALFs to receive the vaccine schedule?
Yeah, I think this is Brooke Tyner. I mean, as Sally mentioned, we won't have that schedule until the state activates those facilities and until we're told by the CDC that we can begin that scheduling. I understand that's in process, but as far as we know, it has not been activated, at least not as of yet. So as soon as we get that information, we can then begin contacting for scheduling purposes.
Thank you so much, Brooke.
And in that regards, I'll also chime in because I saw a message in the chat. What is FALA doing on your behalf to make sure that you are not last in line? We are at the tables. We are part of the discussions with the Department of Emergency Management and Department of Health and the agency. However, there's a certain number of vaccines coming into the state, and they have been based and tiered on acuity. And of course, hospitals are number one, and then they have nursing homes as well as the healthcare providers. So assisted living is right behind. It just hasn't started yet. And if you think about it from the acuity perspective and the transfers back and forth to those other areas of care. That is why that's the plan at this time. In addition, anybody, if you've not heard on the other calls that occur weekly, if you have third parties that are coming into your communities, at the time you are set for a date to have the clinics, you are able to have those third parties participate in the vaccination schedules along with your staff. Another question is regards to if staff or residents receive the vaccine, should they continue to be tested for COVID-19? I heard Dr. Rivkee, as you mentioned, if they receive the vaccine and don't have alleviate symptoms within 2 to 3 days, then yes, they should be tested. But I guess this question is, in between vaccine 1 and vaccine 2, what would that look like for them?
Yeah, so again, first, if between vaccine 1 and vaccine 2, which is 21 days, if somebody develops symptoms of COVID, they absolutely should not work and they should get tested.
Wonderful. Will COVID-19 vaccine group injections be staggered among staff to avoid multiple staff members calling off with side effects?
Hey, this is Sally with Walgreens. So this is a question that has been asked repeatedly, and I want to be careful how I answer it. It has been brought to the attention of the CDC that this is a big concern among facilities, among all long-term care facilities. And so right now we are scheduled by the CDC to give 3 vaccination clinics at each facility. The first clinic would be for first doses. The second clinic would be for a second dose for the people who had their first dose, or for the first dose based on staggered staff schedule, or for new people who just arrived at the facility. And then the third clinic would be to give the second dose to whether it's new people or the staff that were staggered. Having said that, we realize that you have different types of, whether it's night shift or weekend shift, and those 3 clinics may not cover all of those situations. We are working towards a token program where you would hopefully be able to send a staff member into one of our hubs that has inventory on site to get a vaccine there on a scheduled timeline. That system has not been completely worked out yet. But we are hearing you. We're hearing what you're saying about the 3 clinics. And so we do want to make sure that all of your staff is scheduled for a vaccine in a way that doesn't completely disrupt the way that you operate. So that's what we're working towards. We just don't have the perfect answer to give you yet.
Great, thank you, Sally. Tiffani, if you have one, please just jump in. I see one, can we include essential caregivers in the vaccinations? I know about third parties. Kim, will you be able to speak to that quickly?
About visitors?
The essential caregivers, can they be included?
Caregivers. Let me get with Molly on how we're kind of looking at that, and we could definitely get something back to you, Veronica, maybe even mention it on one of our long-term care calls.
Perfect, thank you.
Mm-hmm.
And then can a panelist clarify what information is to be entered into Florida Shots and by whom?
Yeah, so the pharmacies will be entering the vaccine that we gave into Florida Shots. So we'll be entering the patient name, all of their data, as well as which shot they received, whether it's Pfizer, which all of our shots are Pfizer. So that's what we'll be entering into Florida Shots, and that's on our end at the pharmacy.
Yeah, and that's the same for CVS. It's the same process that we use for all of the vaccines currently, and flu vaccine and others.
Great. I know I've heard in different conversations I've had, there are questions regarding Pfizer and the Moderna vaccine, because currently right now, you both CVS and Walgreens are scheduled to come out with Pfizer. Have you heard any discussion in regards to the plan for Moderna? And will you be able to come out with those vaccines in the future, so that if there is hesitancy, which we've all heard discussions about on a national level, and someone does not want to take Pfizer, is there an opportunity for you to come back and provide the Moderna?
This is Brooke again from CBS. I could take that one. I mean, I think that the general answer is at this point, no. There really haven't been those discussions for a number of different reasons. Most importantly, as Dr. Rivkee said, that Moderna hasn't received the approval yet. I do know that under the CDC program, the way that the allocation works is an allocation for vaccines by type, and as you said, the vaccines that were allocated are Pfizer vaccines. Now, that doesn't mean that eventually this may change depending on when we get approval for the vaccine, depending on the rollout, and where we are, 2 or 3 months from now. But as of right now, that really isn't in the plan, because we're concentrating on getting through what we've been assigned to under the federal program.
Great, thank you for that.
Then I see questions regarding consent forms. Can they print off consent forms? Does the original and 2 copies need to be signed when you're providing those consent forms back to the pharmacy?
So they can start working on the consent form now. And Tiffani, I'm not sure if I shared with you the link to our most current consent form, but I can do that and you can send it out. The only caution is that the consent form needs to be presented either to the patient or the patient representative along with the EUA fact sheet when that consent form is being signed, so that the patient or the patient representative is aware of side effects, et cetera. But they can start filling that form out now, today, and whatever process the facility has for getting consent from a patient representative, whether it's verbal or through email, Walgreens will accept that consent. So if it's a verbal consent given over the phone, as long as the facility documents it and signs the consent form documenting that they received consent, then we'll accept that. So it doesn't have to specifically be signed by the representative, as long as it's documented that consent was given. But they should start filling those forms out now.
Perfect. Yeah, and if you could just forward me over that link, I'll be sure to send everyone that's on the call the link to those consent forms today. And I believe
this question maybe for Kim. If we have a third-party provider in our clinics, should we include them in our staff numbers when reporting in ESS how many are vaccinated?
That's correct. Absolutely. That's a great question. And thank you for asking that. Yes, please include that information.
Great. And I'm going to type it so people can see too. Another attendee is asking, we test every 2 weeks. Should we suspend the biweekly testing through the vaccination schedule? Dr. Rivkee, would you have any recommendations there?
I wasn't sure if Kim was going to answer it. Testing should continue.
And AHCA agrees with Dr. Rivkee. Thank you. I couldn't get myself off of mute.
Okay.
Okay. Okay.
I don't see any. I don't see any additional questions. Veronica, did you have any additional questions for the panelists?
I'm scrolling through some of them. There's quite a few, and I've clicked the wrong button. So a few of them people have answered, but you may not see them for those who are on the webinar because they've answered them live. And okay, what happens when a staff member refuses the vaccine? Should they be allowed to work? And I guess I'll add a portion to that because we have been contacted about declinations, and should they be getting a declination form from both residents and or staff if they refuse the vaccine?
Yeah, hi, this is Scott. I'll answer that. As far as residents and things like that, individuals cannot be forced to be vaccinated against their will in terms of residents. And then as far as employers and employees, that's going to depend upon that. Refer that to your general counsels for that question.
And as far as a declination form, it's my recommendation as a past operator to always have someone decline and have that in writing so that, 3 months from now, you can remember that you offered the vaccine on December 20th to Susie Smith. I don't believe there is any standard requirement right now through the Agency for Healthcare for that, but I would suggest that is best practice.
Hey, Veronica, this is Kim. You're right. At this point, we have not provided any guidance to that. But as always, since I'm the regulator, I always say make sure you got some good documentation.
Okay. Let's see. There's 2 more that popped up that I might not have seen. Nope. Oh, there is a question, and I apologize, Sally and Brooke, if you've answered this, but we've heard that you've not been turned on for ALFs yet. However, typically, is there a time frame once you are that you will be contacting the facilities so that they have time to prepare, and what does that look like?
Yeah, I can
go ahead, Brooke.
I was just going to say, I could say generally speaking, there is a lag between the time, and we've been talking to the state about this as well. There is a lag between the time that that the program is turned on and the first clinics are conducted. That lag time can be. But in between that time, there will be scheduling that will be occurring. There will be clinic scheduling that is occurring, and there will be updates into the federal system about when those clinics are occurring. So it just really depends on, again, kind of as we mentioned earlier, the timing about the system being turned on, when the CDC gives us the green light, and when we can start contacting the facilities. But we're focusing right now on getting those SNFs completed and the ones that have been scheduled completed. But there will be scheduling occurring on a rolling basis, but probably not the first vaccine clinics until this SNF is completed. I don't know, Sally, if that's consistent with what you're hearing.
Yeah, that's the same for us. I mean, there is a little bit of a lag time between that getting turned on and pushed down to us as far as scheduling goes. What I would say to make this go more quickly is get those consent forms filled out as quickly as possible. I know in the cases of some ALFs, you have to do it for hundreds of people. So the sooner you start working on that, the better. Secondly, there are parameters, we have to follow parameters around social distancing, airflow, all of those types of things for these clinics, just like has to be followed under normal circumstances. So look at the space that you have. And how you might normally set up for one of us to come in and give a flu clinic. Look at the space for that and see how you can make it consistent with the COVID-19 guidelines and restrictions, and be working on those so that you have your plan in place so that as soon as we are able to contact you, we can schedule you sooner rather than later. I will say what we've heard back from a couple of facilities that we've called this week is that they're just not ready yet. And they have scheduled dates later than we would have hoped, because the forms aren't filled out, or they haven't prepared yet for the space that they need. So please start looking at that in advance and get those forms filled out first and foremost, and that would make this go much more quickly.
Okay, Sally, you mentioned that they weren't ready as quickly as you would like. I think the question is, at a minimum, would they be given 3 days notice, a week's notice? I think people are just trying to get a comfort level on what that could possibly look like, and understanding it's unknown, but especially around the holidays, and even if it's the first of the year, when you're trying to get 3 shifts in throughout a day period, as well as people that may work at other facilities and they choose to come to your clinic because that date and time works better, or they just want it done. Would you say, what would be the minimum notice you think somebody would have to get it on their calendar and to notify their residents and staff?
Yeah, well, it certainly wouldn't be 24 hours notice, unless we found a facility that could be ready in that time frame. I mean, I think we'd be looking at scheduling people about a week in advance, but there have been times where we see open slots, like for next week, where we say, wow, we don't have enough facilities scheduled for next week. We could really fit some more in, and we've got all these teams ready and they're just going to be sitting. So where can we fit more in? So I would say that if a facility can start working on being prepared now, then they can get in more quickly. And I would just urge that they look at that and say, like, okay, how much advance notice do we need? Do we need a week's notice, or can we do this in with 3 days notice?
Okay, that would be good. And someone just put in the chat panel, is there a way, and it might not be now, but we're always evolving with COVID, that they can sign up for open slots, or maybe notify the pharmacies that, yes, we're ready now?
With Walgreens, I can answer that. The answer is yes. So, but that's if you're signed up for Walgreens. So, happy again to share my email and make sure that gets the message gets down to the correct team, if you are signed up with Walgreens.
Yeah, and I guess I just add to that. I mean, certainly all this is evolving. I guess I would make sure that we're, again, distinguishing between facilities. When you say signing up for an open slot, are we talking about facilities that are currently being scheduled, and are we talking about skilled nursing facilities? Are we talking about facilities that may be then activated later in the process? So if you're talking about a skilled nursing facility that's already been activated and already signed up with us and already scheduled, or should have been contacted already, then they should probably work with that person who has contacted them about the scheduling, if there does come to be an open slot. If we're talking about other facilities, in the future that are activated, we'll have to continue to work on that as we continue to work on the scheduling process.
Yes, we're talking about the future, as our audience is assisted living and adult family care homes. So, but I guess still, once they are activated, will there be a process that you identify so that people will be able to flag you and say, we're ready to go, and pick up those open slots as they come up? But I'm sure that you'll work on communication that we can also assist you with sharing to licensed providers throughout the state. Tiffany, I don't see anything else. Do you?
Yeah, I was just about to say, if there aren't any other questions, thank you again, Dr. Rivkee, Kim Smoak, Sally West, Brooke Tenner, for your contributions to this webinar and for everything that you're doing throughout the state in your leadership in your roles at your agencies and entities. We truly appreciate you. Veronica, if you had any closing remarks, you may go do so now.
I just wanted to echo what others have said, but to thank each and every one of you and all of your associates throughout your communities, as well as your residents, for enduring this journey that we all have had to do, but has impacted them immensely. And so as we go into the holiday season, you know, we've been celebrating our heroes since last year, because caregivers are our heroes. And it doesn't matter what role they play in your communities, they all are vital. So just thank you and happy holidays. And if there's anything that we can do for you that we're not, please let us know. Call me, go to our website, hit contact us, and we're here for you. So thank you so much. Thank you, Dr. Rivkee, Kim, Brooke, and Sally. We greatly appreciate you taking time out of your day to provide this. So thank you again.
Thank you all, and have a great day and happy holidays, and stay safe.